Hi everybody, welcome to week 2 of our advanced physical assessment class. I hope you're having a good week. All right, let's see what we've got. So first of all, really good discussion in week 1. You guys did a really nice job of talking about the things in Healthy 2020 and getting a good handle on health promotion and disease prevention, and I thought it was a good week of discussion, so thanks for that. All right, this week we're going to focus on communication and history taking. And I think it's always good, no matter how long you've been a nurse, just to review some really solid history taking and reminders about things that maybe aren't within your normal patient population in order to think about a more maybe holistic approach when doing health history taking. And it's also good to look at this because we need to think about how are we going to teach our students or our staff about history taking. There's a couple things when I talk to my students about addressing with patients and really wanting the patients to open up. One of them is not standing and talking down to them. When I used to work as a staff nurse on the surgical trauma floor, I was really busy. My patients were really sick. But after I got report, I quickly run around and checked on people. And then I went back and spent time with each one. And what I would do was I would go into the room, sit down in the chair next to them, start a dialogue. How was your night? How did you sleep? Symptoms they were having, things like that. And then go on and then do my physical exam. And I really found that while it might seem to take more time to sit down and use that approach, it actually saved me time because it made my patient feel a lot more comfortable and they opened up to me actually more quickly. And it just put them at ease. It was just a good thing to do. So many times now we have our health histories on the computer, and I see so many nurses standing in front of a computer going down through a list of questions and kind of talking down to their patient as they're putting stuff in. And we definitely want computer entry because, we can ask it and put it right in and saving us time. But if there's any way to make that more personable, is if you can lower your computer and sit down and be on the same level as the person when that is being done, or teaching students to make sure that they're taking the time to do some one-on-one eye contact with their patient and not just staring at that computer screen. Anything they can do to make it a little bit more personal and not so just rote and I've got to click through these questions. So that's my 2 cents on that thing. And then trying to get our students to be comfortable with asking questions about sensitive matters. In my current position, I teach maturation, and I teach it to both boys and girls in about 4th or 5th grade who are low-level cognitively and in special education classes. And we talk about penises and erections and premature ejaculations and menstruation, and girls really have 3 holes down there, not just a pee hole and a poop hole. Anybody can do it. So you've just got to get your students to be able to maintain that calm demeanor and address things in a matter-of-fact way, because we all know that if we stay calm and address things in a matter-of-fact way, the patient is calmer, they're much less likely to be embarrassed, and they'll be willing to share more. So I think those are things we need to kind of, maybe that we do automatically, we need to remember to think about them and convey that to our students or new staff. All right, so let's see what we've got this week. Our DQs, we've got one about a patient with short, choppy responses and one about a Native American patient. And they really kind of in some way or another, some of them bring out the idea of cultural sensitivity. And I think all of us as practicing nurses know that that's huge. We've got so many different beliefs based on culture. Belief about how do I respond to someone else asking me a question? How do I respond to a healthcare professional? Do I even believe in Western medicine? So many things come into play. And I think we need to find better ways to at least give our new nurses and our students a heads up about culture. We don't want to portray stereotypes, but I think we need to at least give them a heads up about things that they might encounter with someone from another culture. So we'll be talking a little bit this week about maybe how we go about doing that. And I'll share some things I've done in the past that maybe were helpful. And I really like to hear about things in your workplace that you have found helpful towards having people use and take advantage of cultural sensitivity when they're dealing with patient populations. All right, so the assignment this week has to do with taking a health history. And like I said last week, it can be a friend, a family member, a distant relative, whatever. It just can't be a patient. So that's the one thing. And so remember, it's just history. It's not a physical, just history. You really want to read the directions carefully and make sure you hit every single point because there's kind of 2 sections and you want to make sure you cover everything. The word limit is for the entire document, not including references, 1,500 to, I think it was 2,500. Make sure you read it and follow the word limit. And it's all going to be narrative except the review of systems. That you can just write out each system and make some short comments about what your findings are. But all of the information before the review of systems, the information after review of symptoms, the questions about interview techniques, all that needs to be in a narrative format. And so some of you had asked about the word limit and what about the word limit. And as Masters Prepared Nurses, we need to be able to express ourselves in writing in a clear and concise manner, just including critical information. A Masters Prepared Nurse is not supposed to be an expert at creative writing, but at clear, professional, concise writing. You never know if you're going to be writing an article, writing a proposal, writing something for a newsletter, writing up a lesson that nurses are going to be clicking through on an online learning system of some sort, providing notes for students, whatever it may be. Clear, concise, and professional are going to be critical. So that's why we have a lot of those word limits to help, first of all, guide the depth and force you to really think about your words and which ones are critical and which ones aren't. So that's one of the reasons behind those word counts. One thing I want to tell you about in the rubric, I think it's the very first line, the top score box talks about including A through G. I don't think there is any A through G. Just make sure that you follow all the directions on the assignment tab. And then as far as the history components, please look in your Bates because Bates goes over history taking, and on each body system, it goes over what should be included in a normal history with history taking. So please go ahead and look at that and make sure that you're inclusive of those pieces. All right, let me see. I assigned the collaborative learning communities, and I think almost everybody has checked into those. So hopefully that will be a good experience for you in this course. All right, I think that's about it for this week. I hope you had a good week. I hope you're looking forward to a good weekend, and I'll see you in the main forum.